Today we are discussing about a topic called atelectasis. We are very clear about what is atelectasis. We are mainly discussing here the X-rays of the chest showing the collapsed different lobes of the lungs. So here I am telling you initially atelectasis, it means incomplete stretching. That is a Greek word, it is called incomplete stretching. So in pulmonary radiology, the term atelectasis is used to indicate loss of lung volume. So it is called loss of lung volume associated with a decrease in the amount of air within the alveoli. Decrease in the amount of air within the alveoli. Atelectasis, which is a loss of lung volume, it is usually but not always associated with lung consolidations. Filling of alveoli by fluid, that is consolidation. So it is not always associated with consolidation. Not always associated with consolidation. Of course, if the alveoli is fully collapsed, if it is fully collapsed, then there cannot be consolidation. So consolidation can happen only if the alveoli is partially collapsed. However, atelectasis and consolidation are separate processes, which may or may not occur in combination. The presence of atelectasis in contradistinction to consolidation may be important in differential diagnosis, as it may indicate bronchial obstruction by variety of abnormalities. As with consolidation, atelectasis may or may not be lobar. So now we are seeing the type of atelectasis. There are 4 different types of atelectasis, that is lung collapse, and are generally recognized. So this table is a important table where we discuss about the types of atelectasis. First one is resorption or obstructive atelectasis. So which means it is caused by the airway obstruction. Airway obstruction. That is when the airway is obstructed. So let me clearly tell you what is that. This is an airway. If this airway is obstructed, the whole lung, the air in this alveoli is taken to the blood, and this whole alveoli will shrink. So that is obstruction. So there is be resorption of alveolar gases. So it occurs within 48 hours. It's more rapid when breathing oxygen. Do it happen? So as we're telling here that obstructive atelectasis is more rapid when breathing oxygen. So the question arises, why it is? When breathing more oxygen, why obstructive atelectasis do happen? Because the point number 1 is oxygen are absorbed quickly. Oxygen are absorbed quickly. The point number 2 is that no nitrogen to keep alveoli open. No nitrogen to keep alveoli open. The point number 3, the blocked airway prevents its reinflation. The blocked airway prevents reinflations. So these are the major 3 reasons why breathing pure oxygen or high concentration oxygen, the rate of alveolar collapse increases. Next is it may result in drowned lungs with little volume loss. result in drowned lungs. What is drowned lungs? So drowned lungs here uh, it means the appearance or condition of the lungs when they are filled with fluid. So it's a resemblance. It's not a formal medical term. Okay. So next point is this: collateral ventilation may prevent collapse. Collateral ventilation may prevent collapse. With large airway obstruction, air bronchogram are often absent. Of course, if the large airway itself is obstructed, then how can the air bronchogram occur? It can never happen. It's absent. It's absent. So that's about the obstructive atelectasis or resorptive atelectasis. Then comes the relaxation atelectasis. How you it is known as passive atelectasis. When you relax, what you do? You inhale a breath and exhale it. Exhalation is a passive process. So relaxation means a passive. So it's a passive atelectasis. It's called passive atelectasis. So atelectasis due to pleural effusion, pneumothorax, or some mass. It is called passive atelectasis. The lung density need not be increased. Okay, that is about passive atelectasis or relaxation atelectasis. Then comes the adhesive atelectasis. Adhesive atelectasis means atelectasis caused by loss of lung surfactants. You know, the lung surfactant prevent the collapse of lungs. So if the surfactant is lost, the alveolar will collapse. So it form an adhesion between the adjacent alveolar membrane. So it will cause adhesion. So typical of respiratory distress syndrome of the newborn, that is respiratory distress syndrome RDS, acute respiratory distress syndrome ARDS, or radiation pneumonitis. Last is the cicatricial atelectasis. Cicatricial atelectasis means due to lung fibrosis. It's because of lung fibrosis only it happens, lung fibrosis. So these are the four main type of atelectasis. First one is resorption or obstructive atelectasis. Second one is we know passive or relaxation atelectasis. Third one is called loss of surfactant, that is adhesive atelectasis, and fourth one is what we call cicatricial atelectasis.